So last week we went over the pause part of the PURE model, and this goes back into negotiations and communications. Do you want to summarize it?
Yeah, the pause section is extremely important, and it can happen almost at any point during the interaction, because most interactions go south because of your own emotions. And if you don't realize that, if you don't take even 1 or 2 breaths to realize, hey, you know, I'm getting revved up, I'm not thinking straight, you'll just be a puppet and you'll be controlled by your emotions as opposed to being in charge of yourself in the situation.
Did anyone have any questions on that part before we move on? You're laughing at all these random pictures. This is a different picture. But do you want to summarize this one?
Did you find a new picture?
That's your picture you found.
I thought they used to all face the same direction. Am I hallucinating? Is that the same one we've always had?
No, it's a different picture.
It is different. Where'd you find a new picture?
We'll talk about it.
Why am I alone in this picture? Okay, so the next part of PURE is uniting. And that's, you can see the cat blending in with the, what are those things called? Meerkats. So getting on the same page. I mean, seek first to understand, but we'll go into more detail with the subsequent slides. Do you have anything on that?
No. I think this is a big part of it.
Okay, so one of the important things when you're interacting with somebody is try to minimize any surprises. It can also be called telegraphing. So letting somebody know what to expect. That's true if you're working in an office building or you're a doctor seeing a patient. There's nothing worse than going to the doctor and then waiting in the waiting room and not knowing what's going on, and then they shuffle you in and they talk to you for 10 minutes and then you're gone. It'd be much better to spend that extra 10 seconds, someone let you know, hey, the doctor's running half an hour late, and then he'll see you for 10, he'll see you for 10, he or she will see you for 10 minutes, and you know, just let people know what to go. It's very respectful. Even if you're taking someone to jail, hey, you're going to jail, this is what to expect where you're at the jail, this is what you're gonna see, and this is what's gonna happen. Just goes a long way.
I think if you or you have anyone that you know, coworkers or employees that are having difficulty with basic calls, if people are saying that someone seems short on a call or this officer is being disrespectful, I think this one goes a long way as an easy to use technique, and just let that person know, hey, I'm out here to take this burglary call, but I only have about 5 minutes on this. You know, unfortunately, there's 30 more calls holding that to get to, so I have to ask some specific questions. Setting that standard can really help somebody, especially with people with some certain disabilities or injuries. I think about people with brain injuries sometimes are very hard to communicate with at times and to set the stage for what to expect. And sometimes just starting your conversation or your initial interview with letting them know, hey, I'm going to ask you some questions. Some of them might be private, or
then there's some questions. What? You say, we will talk for about 15 minutes. Then there's some questions.
That's Louisiana talk. Then there's some questions. We're going to let them know what to expect. Then there's some questions right now for you. Just set it up for him and let him know. This is why Nils needs sleep. He's very distracted when all of a sudden it comes up. Oh, man.
So active listening. Active listening is something that we hopefully on this network all know very well. We can review it quickly. Really, the main one is emotional labeling. Is probably, if you can only use one, that's probably the one. The other one that's probably the most important that is overlooked all the time is not talking. You know, if those are the only two you use, emotional labeling and not talking, that's sort of the heart of active listening. So you don't need to remember Rome pie or more pie or all of it. Just remember to keep your mouth shut and stop thinking about what you're going to say next, which is a very hard thing to do, to sit and listen to somebody without thinking, oh, that reminds me, oh, I should say this, oh, I got to say that, because you inevitably interrupt people. And that 5 for 5 guideline is something that I guess we were teaching people is, if you know you're going to have a 30-minute visit, you use either 5% of your time or 5 minutes to do nothing but really listen. And the odds of you getting to 5 minutes are basically none if you can do it. So what I mean by that is, if you have the discipline not to talk, the other person will stop talking within 5 minutes, almost guaranteed, unless they are manic or demented. Most people, honestly, I think the studies show most people stop talking in about a minute, minute and a half at most. And it'll feel like forever, and you'll be thinking about what to say and all the clever things insights you have, and how you're going to make a big impact by these key pearls of wisdom. But really, the best thing you could do is just not say anything and just sort of nod and be there and listen.
But like Doc was saying, if you're talking to someone, they just keep going on and on and on, realize that is an indicator of,
pathology.
Right, that someone might be in a crisis, or they're having behavioral health issues, or they may be having a difficult time in communication. So you might have to switch up how you ask questions, or your interview style, or be prepared to repeat yourself or cut people off. But use that as a clue into what's going on with that person.
It would be if you have the chance, when you're on a call or you're talking to a coworker or anything, try it. Try to actually listen and see how long the other person talks before there's like a silence that's long enough that, like, okay, they're done talking. Because most people don't wait for a silence that's long enough that it feels like, okay, they're really done. Usually there's a lot of studies about the beats between conversations and how quickly one person talks and the next person talks. Men usually interrupt more often than women. And they're sort of that's why computers often seem so weird, because they don't follow the same sort of nuances that we take for granted. But if you wait that one extra second, the other person's either going to continue talking or you have the all clear to talk. It takes practice.
So you don't interrupt that often.
Go F yourself.
Women are more like that. That's very unique. I didn't know that. So the 7 active listening skills.
No, women are less likely to interrupt.
I know, you don't interrupt.
I got it.
Yeah,
that took me a while.
I got it.
But the most likely combination of interrupting is a man to a woman. But men interrupt each other constantly. And women are usually, this is the generalizations, but based on studies, and women are more likely to give each other a chance to talk and listen.
I find that interesting.
That's interesting. I didn't know that.
Yeah.
Yeah.
So the 7 active listening skills, we teach this a lot throughout our CIT classes and our enhanced CIT classes. And, these are just skills that have been studied and shown to work for rapport building on it. And so mostly, I'll just go to these real quick because you guys have probably heard this 8 million times, but reflecting and mirroring is just saying the gist of a sentence to the last part, and voice inflection is very important. Open-ended questions, I always think of an acronym that Nils taught me, which is what. So what, how, and tell me more. Changing things into questions that guide people to just continue talking and not answer with yes or no's. Minimal encouragers are the okay, little things that we do just to let people know that we're listening. Emotion labeling is what Doc was saying. You just simply say what someone is, an emotion that they're demonstrating, or an emotion that you hear from them, like, wow, you seem sad, or you look pissed off, or, you seem devastated, whatever that is, just labeling an emotion out there. Paraphrasing is putting the conversation into your own words, or what they're saying into your own words. You also might see some schools or training have paraphrasing and summary as 2 different things, and paraphrasing, what they'd say is, putting it into your own words, and summarizing is trying to wrap up a call or summarizing what's been done. iMessages, I think, are one of the most difficult for myself personally. Do you want to try to explain the iMessages? You're typically better at that.
Am I? Thank you. I think it's like a script, right? I feel X when you do Y. Would you please something, right? So I feel nervous when I see you pacing. Would you please mind sitting down?
Okay.
X, Y, too complicated?
Yeah, that was too complicated.
Okay. I feel blank when you do blank, like a Mad Lib. I'm not really old. That way.
iMessages are a way to humanize yourself so you come across less authoritative. You know, people are going to see you in uniform. They already are expecting you to give commands, expecting things like that. And so if you're trying to build rapport and joining sides with somebody to influence their decision, these are a good one. You know, like, hey, I really need to ask you some questions. It's hard while you're pacing. Do you mind sitting down? And it's not just like, I'm telling you to sit down. It's a way to try to humanize yourself. And effective pauses are just that. You say something that's meaningful, or you're asking an important question, or you're giving maybe a safety exit plan or any kind of safety thing, and you just stop talking. Let that awkward silence go and make someone have to fill in that gap. Sometimes if you barely start a rapport with somebody, even if they're not talking, but they're engaged with you, they're looking at you, they're nodding as you're talking to them. This could be like a jumper on a bridge or something like that. Just stop talking. It's going to be awkward, and they're going to want to fill in the blanks on that. Or which one of these skills do any of you guys use just normally? Do you guys have a go-to on one of these? Jen, people are typing.
Someone said something.
Sorry, TJ Camacho, SPD. I usually use a lot of open-ended questions to keep the conversation going. Let them tell me what I want to figure out rather than ask them questions. Sometimes I just keep it open, and they'll sometimes spill it out.
I think that's great.
Yeah.
I think
Fantastic.
it's a great technique to use in criminal interviews too, is let people confess on their own instead of having to lead them or guide them.
Do you have any that work for you? This is Karen, but that's a short weakness I have is open-ended questions. I was going to say shortfall, and I changed my mind.
Wait, what was your question?
For TJ, because he said he uses that a lot.
Oh, like what is some good ones? Yeah.
Usually I use it in combination with a lot of hooks. When using like hooks, I'll start asking them open-ended questions about their job or their tattoos, just to kind of build rapport, and then I'll start going into more questions. But it's something you have to think about asking open-ended questions when talking to people. Otherwise, you're kind of stuck answering questions you just want to hear the answer to, in my opinion.
That's good. Thank you.
Yeah, thank you.
Well, that's great. Any other ones that you guys use naturally a lot that you enjoy?
Officer Chacon says that he uses emotional.
Nice.
Sanford Chacon always says, wow, you seem excited. Wow, you seem excited.
Everybody's excited.
Wow, you're excited. Just kidding, Javi. Sorry. I'm a huge fan of emotion labeling. I think it's one of the most effective skills. I honestly do.
Does it work for him? Does it work for you?
Me or Chacon?
Can you hear me?
Yes, it does.
There's a lot of input there.
That was a close-ended question.
That is a perfect example of how close-ended questions
Yeah.
work, though. I mean, it's like yes or no on it, and it's kind of hard. I think I think emotion labeling is one that a lot of people feel uncomfortable with, but it is one of the most effective ones, in my opinion. Nils likes to use minimal encouragers a lot. Yeah, it's okay. He does it a lot, but one of the best that I could say that he uses, which seems so doctory to me, but then it works well for opening questions, is tell me more about this. Tell me more. And I always thought that sounded so clinical, but people will, like TJ was saying, they'll just keep talking and talking. And if they bring up something like you're doing a criminal investigation, like, oh, they deserved it. Oh, tell me more about when you said they deserve this. And people just fill it in. You're not leading them. They just keep wanting to talk and talk and talk for it. Does anyone have any questions on the active listening skills?
Can you repeat the acronym
What, how, and tell me more.
Thanks.
What about times when these don't work, Nils?
Well, they always work.
When are some times that you've noticed building rapport just doesn't seem to work? feel like we teach these a lot and we don't necessarily teach when they don't work.
Oh, I think I think it's just like anything else. It's on a continuum. It works very, very well on some people, and it doesn't work very well on others. I think with people who are very manic or demented, they're going to probably be a little less successful. Someone who's drunk, probably a little less successful. You know, any kind of brain injury, serious pathology where they can't, even focus on a conversation. But I think in the cases where they don't work, it's not like other things are going to work great either.
Right.
In terms of communication. And, there's clearly, you have that acronym SAFER. I mean, there are times when it's time to stop talking and start acting. And that's for you guys. I mean, in medicine, that's, I leave the room and we give them a shot. But for you guys,
we also give shots. Different thing. So IT, can you bleep out that last part on
No.
this?
What does that say?
Uncover true motivations.
Yes, that's a good idea.
So, thank you, Nils. Oh, Nils. One of the things when it comes to this, I think, and some of the stuff when we get into the idea of negotiations, we start thinking about haggling with people. And sometimes you got to try to find the real reason why someone's not doing something. What is the true motivation behind the reason why they're on the bridge, or why they're refusing to come out of the house or leave a room? What is the reason? Are they embarrassed? Or do they, are they just trying to make a point? Whatever it is, try to uncover the true motivations on it. And
the example I use all the time is negotiating for a job. So if you are negotiating for a job, I guess you guys don't do that much because you're all, but just imagine you're negotiating for a job and you're discussing the salary. You may end up haggling over the last $1,000, $5,000 and going back and forth. But what you're better off doing, and the other person you're haggling with is better off doing, is what is your true motivation? What is their true motivation? So meaning what the money is just a tool to get something else. Money is just an opportunity. The money is not a thing it's not an end to itself. So maybe what you really want is the job, but you want more time with your family, or you want the job and you want to be able to go to school, or you want the job or X, Y, and Z. You can negotiate those things. But if you don't know what your true motivations are, and you get hung up on one little thing like do this, do this, do this, do this, you get caught up in the trees and you miss the forest. If that makes sense. Anybody? I don't know if I'm making sense.
No, that makes sense. I think this is a huge skill that we don't often do in law enforcement, but this kind of obviously stating the problem, or, what is the true problem at hand. I feel like we hide things in law enforcement because we think it's a safety issue, or we don't want to just state the obvious on either like, well, this is what the law says, or this is what our policies say. Sometimes saying the obvious and putting it out in the open can get the conversation going. You're not hiding something from the person you're trying to communicate or negotiate with. You're just stating the obvious so that you guys can work on the same thing together.
I think stating the problem is a nice little tool to have, a communication tool, because if whatever the situation is, and you just state it out loud and make it obvious, it just helps frame everything and get you on the same page with that other person. Because if you state the problem and they agree, then at least you have a shared problem. Like if the problem is we're surrounded by lions and we have no gas, that's then you can start formulating a plan. But if you just kind of freak out and don't really focus on the issue, you can sort of end up going around in circles. Or the problem is, I have to take you to the hospital and you're not wanting to go, or whatever the case may be.
And it does go a long way. And it's the same thing if you are getting into negotiations on your department, or you want to do like CIT, crisis negotiations team. The problem is typically someone's inside the house. It's not their previous offense. It's not like the problem is you murdered this person or you committed this felony. The problem at hand is we want you out of the house to talk to you. And it's hard for us in law enforcement to not start diving into those other problems, to be like, oh, tell me about what you did with this person. That's not the problem that you're solving. And so sometimes this really helps get us back on track. And this goes a long way too if you're doing high-risk negotiations with suicidal subjects, like on a bridge. Stating it out loud also lets everyone else, all the other officers and support staff around you, know what's going on. It puts you guys all back on the same page. You know, the problem is you're behind that barrier and I see a gun in your waistband. Lets everyone know what's going on and everyone's aware of it.
So finding shared goals. So whenever you're negotiating about anything, it's always ideal to find what you agree on and try to expand from there, as opposed to focus on what you want and argue with what they want and just sort of go back and forth, because you just get more entrenched into your own position. So it's better to say, hey, I know you want to pay me, $20,000 and I want $25,000, but we both agree you want me to work here. And then you work from there. Does that make sense? Or you take the negotiation from there as opposed to digging into your one position.
And sometimes, I'm thinking about home visits. If the common shared goals, we want the safety of everybody. And we can only guarantee safety as law enforcement to some extent. And so if someone is paranoid, we can guarantee their safety. But, if the ultimate reason why we're out there is to make sure they're okay, we can look at that as a shared goal. Everyone wants to feel safe and be okay. And then you can start working on negotiating. Is it because we need you to go to the hospital now for further evaluation? Or do we need you to follow up on certain resources or to do things? But finding that shared goal can help, but it can be difficult.
Yeah, absolutely.
Is this to say that, this is Dan Duhigg, would you differentiate this from this? You're not talking about compromise, it sounds like. You're talking about finding something that you have in common to get to your goal.
Yeah.
Is that accurate?
Yes.
Right. This is a way, and I know TJ was talking about hooks before. This is a good way to find certain hooks in somebody. Find something that you guys both agree on, and then that way you can start negotiating and building that rapport around it. I mean, it's something you both agree on. You're not going to agree like, hey, I'm going to give you this gun and let you go do whatever, or here's a helicopter for you to escape. That's not going to be a shared goal, but if a shared goal is safety and getting you out of a building, you can come up with ways to do that.
Safety is always a very good shared goal. Okay, so find shared goals. So in order to focus on the shared goals, you have to find the shared goals. And so this is sitting on the same side of the table is just a nice way to remember sort of the idea of triangulation, which comes later in the lecture, but Matt and I can demonstrate here. Okay, so let's say Matt and I have this piece of paper that we're negotiating about, whatever information is on here. Matt, you look at me. And so,
Should we
But some people
Can they
are
see
by
it?
phone.
yeah, can't they see us?
Yeah.
Okay.
Okay, and so we're fighting about this. We're going back and forth. He wants this and I want that, and we're fighting back and forth about that. It's much better if we place this sort of over here in the foreground and we look at it together.
Got it.
And we say, hey, we're fighting over this contract or this piece of paper or this pickup order. What are we going to do about this? How are we going to fix this? How are we going to make this work? And you use we language instead of you. And say, because if you're like this, it's, well, you want to do this and I want to do that and you're an idiot and I'm the best, as opposed to putting it over here and say, we're in this together.
And for those on the phone, I mean, we're literally talking about it's trying to take away the you versus them kind of mentality. And so one technique that I would always use with it, because I always have a pen with me, is I will put a pen down and talk to the pen with someone. Like, you know what, there's a pickup order, and even if I don't have it in hand, it's that. Or you keep calling 911, and if you keep doing that, you're going to go to jail. It's not me saying that. I'm not the one saying I'm going to take you to jail. It's we're both looking at the problem as this problem together, that someone's doing this, and how do we solve it? And it's an easy way to kind of get out of the habits of problem solving. People want to feel like they're part of the solution. And if we just keep kind of, here's this warrant, here's this pickup order, here's this, I'm telling you, it can put up a barrier. But joining sides with someone and uniting with them, it's an easy technique to use. And if you're doing it by phone, like a phone conversation, sometimes literally drawing a stick figure or drawing something or putting something in front of you where you're not arguing with somebody on the phone, but you're looking at something and kind of using that object as the actual problem can help you get out of arguing, which is difficult.
Yeah, absolutely. So setting boundaries around yourself, often especially in medicine and in the psychiatric, psychological community, we talk about setting boundaries. This person needs boundaries. But really, the difference here is that you should be looking at boundaries around yourself and not around other people. Around you, maybe around your institution or unit. Because if someone's constantly calling you and asking for this or that, or they want to, come up and shake your hand all the time, it's really up to you and what boundaries you're comfortable with. Not, I'm going to set boundaries around this one person and that one person, and each as a time. You have to decide what you're willing or not willing to do as a general rule, because you can't dictate the behavior of other people. It's hard enough to stick to your own boundaries and rules.
The most common boundaries I see with us in law enforcement that we normally come up with right away is if we're going to shake hands with people.
Yeah, that's a great example.
A lot of officers I'll never shake hands. I might give a fist bump or knuckles to people, or others will just say, while on duty, I don't shake hands with people. And a lot of times officers feel fine explaining that to people too.
Yeah.
But when it comes to other things like how often will you follow up, or what can you guarantee that you'll come check on me, and all this kind of stuff, some of them are just unrealistic. And how close we let people get to us in certain settings and things like that. Setting your professional boundaries can save you a lot of headache, especially with some personality disorders that you get. Do you have any, how do you go about setting boundaries? I mean, what are some professional boundaries you see in law enforcement that we should probably have or look at?
Well, I think the example you gave was a perfect one about shaking hands. Should you shake hands? Should you not shake hands? That's a personal boundary that you want to set. Do you, make extra calls to people on off work hours? Do you give people your direct cell phone? Do you, and there's not right answers. You just want to know what the boundaries are. What other things? I mean, obviously with very clear boundaries about, here's the person, and then there's the female or somebody of the opposite sex. How much do I interact with that person? Do I, get involved with them? These are some obvious boundaries.
I don't know. Can you elaborate more? Tell me more about getting involved with them. What does that mean?
No.
That's when active listening did not work. But I think it's an important one to have, because all of a sudden, if you get called in on why did you do this for this person and not this person, you have to be able to explain it. And having professional boundaries can help you, especially if they're not given to you by your department. And so, do you want to summarize this uniting section?
Yeah, I think uniting, it really is about getting on the same page with the other person. It is, in many ways, can be thought of as the cornerstone or the foundation of all empathy. Understanding what the other person is going through, being able to articulate back to them that you understand what's going on, and then finding some common ground is the last step. So it's empathy, and then where you agree.
So some of these, especially if you guys are having difficulty with arguing, I think remembering to triangulate and focus it on the problem at hand can really help. And so this was the next section that we did was uniting on this. And so this is a good summarized slide right here. So no surprises, use active listening skills when it's safe to do, uncover the true motivations, seeing the problem, finding shared goals, and setting boundaries around yourself. Do we have any questions about this section of it? Or thoughts?
Again, so just to cover it again, Dan doing here, fail-safe is kind of what that's the outcome that you kind of want and need to have happen if they don't choose what you offer them. So what that means?
The fail-safe in the pause is, knowing what you can do unilaterally and that you're okay doing, you're comfortable doing.
After you've offered them a menu of options,
yes.
You offer them the opportunity to choose and be engaged, and then if they're not, you still need to do what you need to do. Okay.
And be okay with it.
And be okay with it, yeah.